Hello everyone. In this session, we are going to discuss the ultra important topic in microbiology, that is genital tract infections. So in this batch, the Prof. Buster Live Progenitor batch, we are studying all the systems in integration. We have already started genital system and we have completed all genital tract disorders in pathology in male genital tract as well as female genital tract. We have completed all the disorders and now it's time to study microbiology in the genital tract, right? So let me share my screen with you. I guess you can see the screen. So as I told you, in this batch, the Prof. Buster Live Progenitor batch, we have started integrated genital system. Okay, so we have completed this system from pathology, the male genital tract disorders and female genital tract disorders. We have completed important disorders as well as cancers in both male and female genital tract. And now here in this session, I will be discussing all genital tract infections. I will be teaching you bacterial, viral, fungal as well as parasitic infections. So we will discuss microbiology of genital tract infections. So this session is microbiology session. So as you know, in microbiology, we divide the human body into 9 systems and I assign one unique color to each system. You can see my color coding to make it uniform, to make it easy, right? And in each system, we divide that system into 5 portions. So currently, my system of choice, my system of interest is genital tract infections. So to which I have assigned brown color. You all can see brown color, right? Now, like all other systems, I divide genital tract infections, genital tract system also into 5 systems, into 5 portions. Number 1, syndromes in the system. Okay, bacterial, viral, fungal, and parasitic infections associated with this system. So here you can see the master chart of genital tract infections. Appreciate the brown color. Appreciate the 5 portions. So what are the 5 portions? 5 segments we are dividing the system. First of all, you can see the syndromes associated with genital tract infections. You can see the bacteria. You can see the virus. You can see the parasite. And you can see the fungus. You can appreciate the 5 portions. We are dividing this system. So whenever any patient comes to you and complaining of the genital tract infection symptoms like the genital ulcers, okay, genital blisters, genital organ swelling, so you must have differential. And if you are suspecting it's infectious in origin, it's an STD, if you are suspecting that, you should have differential diagnosis of all these organisms in your mind. So if you count all these organisms are total 11 organisms. You can see out of the 11 organisms, 8 of them are bacteria. You can appreciate the 8 bacteria here. You can see one of them is virus. Appreciate one virus over here. One of them is parasite. Appreciate one parasite. And one of them is fungus. Appreciate the fungus. So you can see total 11 organisms and one syndrome, that is STD. Approach to STD. This is the syndrome. This constitutes the entire unit, that is genital tract infections. So whenever any patient complains of genital tract infection symptoms, okay, maybe genital ulcers, maybe genital blisters, okay, maybe genital swelling, and we are suspecting a STD, we are suspecting an infectious origin, you must have differential diagnosis of all these 11 organisms in your mind. So today in this one session, we are going to complete all these 11 organisms in a comparative manner. So I will be discussing the 11 organisms in 6 master charts. In the 6 master chart, I will cover the 8 bacteria in 3 master chart, 1 for virus, 1 for parasite, 1 for fungus. So total in 6 pages, we will compact the entire unit genital tract infections. So before I start the unit, we will take a bird's eye view. We will see an overview of this unit and then move on the discussion organism by organism. So let me tell you the bird's eye view over here. You can see these are the total genital tract infections. First of all, I will be discussing the approach to STD. I will be starting with the syndrome. In the syndrome, I will be simply telling you only one thing, how to approach STD in the form of a table, in a form of a flowchart. After that, we will move on bacterias. Okay, you can see the 8 bacterias in front of you. Can you appreciate? We are dividing these bacteria into 3 portions. Let me tell you. So these 4 bacteria cause genital ulcers. Okay, we will make one master chart for them. The remaining 3 bacteria cause genital infections. They don't cause genital ulcer. They cause genital infection. It can be urethritis, cervicitis, epididymitis, vaginitis. That is genital tract infection, but there is no ulcer. And third, genital TB. Okay, Mycobacterium tuberculosis. You can see these are the 4 bacteria which cause genital ulcer. First, you learn their name. What are the 4 bacteria which cause genital ulcers? Trypanosoma pallidum, that is syphilis. Haemophilus ducrei, okay. Chlamydia trachomatis L1, L2, L3, that is LGV, they will cause LGV, and Klebsiella granulomatosis. Okay, so Trypanosoma pallidum cause syphilis, also known as chancre. It is also known as hard chancre, also known as primary chancre. Haemophilus ducrei causes chancroid, that is soft chancre, okay, soft ulcer. L1, L2, L3, Chlamydia trachomatis L1, L2, L3 cause LGV. Okay, and Klebsiella granulomatosis matis cause Donovanosis. These are the name of the STDs. These are the name of the ulcer they are causing. They all cause genital ulcer. I will tell you the step-by-step approach how to differentiate the ulcer of these four STDs. Okay, they all have genital ulcers. Got it? Now, these three do not cause ulcers. The remaining three bacteria, they do not cause genital ulcer, but they cause genital tract infection. Maybe in the male, they can cause urethritis, epididymitis, prostatitis. In a female, they can cause cervicitis, vaginitis, okay, salpingitis. So these are genital tract infections. Okay, so the three bacteria over here is Neisseria gonorrhoeae, again Chlamydia trachomatis, but it is D2K, serotype D2K. Here the serovars were L1, L2, L3. Here the serovar is D2K. You can appreciate. I will teach you Chlamydia trachomatis 2 times. One in the ulcer and one in the genital infection. Okay, these do not cause ulcers. They cause genital tract infection. Which infection I will let you know. What are the infection in male? What are the infection in female? Like that. Okay, and the third here is urogenital mycoplasma. So these three bacteria causes genital tract infection. They don't cause ulcers. These 4 bacteria causes ulcers. So 4 and 3, 7 bacteria. And the 8th and the last bacteria cause TB. TB is also infection, but we take it separately. It is known as genital TB. So it is Mycobacterium tuberculosis which cause genital TB. So you appreciated the 8 bacteria. Appreciate. First of all, learn the name of these 8 bacteria. Out of these 8 bacteria, the 4 which cause ulcer, that should be at the tip of your tongue. The next 3 which cause infection, that should be at the tip of your tongue. And the 1 which cause TB. Total 8 bacteria are there. You should learn their names thoroughly in 3 master chart. 1 master chart for ulcer, 1 for infection, and 1 for TB. Total 3 master chart. Now, come on the virus. Can you appreciate the virus? We are having only one virus which causes genital tract infection. The name of the virus is herpes. It also causes genital ulcer. Not ulcer, it causes genital blisters. Okay, genital tract blisters. So that is herpes. Among the herpes, we have 8 type of herpes. I guess everyone knows. So among that, HSV1 and HSV2, most importantly, HSV2 we are going to discuss here. Herpes simplex virus 2. So that is the virus we will discuss under a fixed set of heading. Then we will come on the parasite. We have a single parasite which causes STD. The name of that parasite is Trichomoniasis vaginalis. We will study its detail under a fixed set of heading. You know our fixed set of heading for bacteria, virus, fungus, and parasite. And finally, we are having single fungus. We will see its detail. The name of the fungus is Candida. You can see Candida, single fungus we are having to discuss under a fixed set of heading. That will cause genital tract infections. Okay, so that is Candida. So, before I teach you the 11 organisms, total 11 organisms, 8 bacteria I will teach you, 1 virus, 1 parasite, and 1 fungus. In this sequence, I will teach you. Bacteria I will divide in 3 categories. The one which cause ulcers, the one which cause infections, genital tract infections, not ulcers, and the one which cause TB. Okay, so here we have 4 bacteria. Here we have 3 bacteria, and here we have 1 bacteria. Virus cause blisters. Okay, parasite cause infection, and fungus also cause infection. So please understand what I am saying. Please understand. These 4 cause ulcer. So we have to do a approach for them. How to differentiate the ulcers of them. Okay, they all cause infections. TB is also an infection. Okay, they also cause infection. Parasite. Fungus also cause infection. But virus produce blister. Blister is a type of ulcer, you can say. Okay, multiple small blisters are there. So total, if you consider how many organisms cause genital tract ulcers. So we are having 4 bacteria and 1 virus. Total 5 organisms. They cause genital tract ulcers. The remaining organism, the remaining bacteria, the remaining parasite, the remaining fungus, they cause infection. You understand it. They are causing infection. So how many of them are causing ulcer? Among the bacteria, these 4 causes ulcer. Please read their name. Okay, and among parasite do not cause ulcer, they cause infection. Fungus do not cause ulcer, they cause infection. Among the virus, only 1 virus is there, herpes, that also cause ulcer. Not ulcer, but the blister. So if you are finding, okay, if a patient is coming with some genital tract ulcer or blister, what should be your approach? How many differential diagnoses should come in your mind? So out of the 11 organisms, 5 of them should come in your mind. You're getting my, so for them, I will tell you a approach that is known as approach to STD. How to do the differential diagnosis among them, how to differentiate them. So is it an ulcer of syphilis? Is it an ulcer of chancroid? Is it an ulcer of LGV? Is it an ulcer of Donovanosis? Or is it an ulcer of virus herpes? So we are having 5 differential diagnoses because they cause ulcers, and other all 11 organism among the 11 organism apart from these 5, the remaining of them, they cause infection, they don't cause ulcer. I hope you got it. So this is the approach to STD. I'm starting with the syndromes, people. I'm teaching you approach to STD. In the approach to STD, total 11 organisms are there. Among 11, 5 of them cause genital ulcer or blister. So I'm telling you approach for these 5, not for the remaining. The remaining are causing infection. We have to do various tests for them. But looking at the ulcer itself, how we can decide, is it an ulcer of which among the 5? You're getting my point. So what 5 organisms are there which cause genital ulcer? 4 of them are bacteria. Out of the 8 bacteria, 4 of them cause ulcer. Which 4? Number 1, Trypanosoma pallidum, which cause syphilis. Haemophilus ducrei, not 4, I'm sorry. Yes, 4 of them. Haemophilus ducrei, which cause chancroid. Chlamydia trachomatis L1, L2, L3 causes LGV, and Klebsiella granulomatis causes Donovanosis. And apart from that, herpes virus. So we will see the differential diagnosis among these 5. You can appreciate 1, 2, 3, 4, 5. 4 bacteria and 1 virus, total 5 organisms which cause genital ulcer. So if a patient is coming to a doctor that the patient is having genital ulcer, maybe male patient, maybe female patient, the first thing we have to see, we have to ask the patient and we have to examine, is that ulcer is painless or painful? That is the approach. The genital ulcer is painless or painful. Okay, so if it is painless, we are having 3 differential diagnoses. 1, 2, 3. 3 bacteria. And if it is painful, we are having 2 differential diagnoses. 1 bacteria, 1 virus. Okay, so based on that, we will differentiate them. Is it painless or painful? If it is painless, it can be syphilis, I mean Trypanosoma pallidum. It can be LGV, I mean Chlamydia trachomatis L1, L2, L3. Or it can be Donovanosis, that is Klebsiella granulomatis. Okay, but if it is painful, it is Haemophilus ducrei, chancroid. Or it can be a virus herpes. Okay, so first of all, you have to see ulcer is painless. The genital ulcer is painless or painful. If it is painless or painful, then the next thing you have to see is the inguinal lymphadenopathy. Okay, now suppose this is a male patient. You can appreciate this is the penis of the male patient, or suppose this is a female patient. This is labia majora and labia minora of the female patient. So whenever the patient presents with an ulcer on the genitalia, with an ulcer, maybe single, maybe multiple ulcer on the genitalia. The second thing, first thing we have to see whether this ulcer is painful or painless. Whether this ulcer is painful or painless. Pain is present or absent. The second thing we have to see is the inguinal lymphadenopathy. Whenever there is a genital ulcer, most of the time it is associated with inguinal lymphadenopathy. The inguinal lymphadenopathy here is known as bubo. The enlarged lymph nodes here is known as bubo. Bubos is inguinal lymphadenopathy, the enlarged lymph node. Then the next thing we have to see is the inguinal lymphadenopathy, and we will decide this inguinal lymphadenopathy is painful or painless. This inguinal lymphadenopathy is painful or painless. So various combinations can be there. First you see ulcer is painful or painless, and then you see the inguinal lymphadenopathy is painful or painless, based on which we are doing the differential diagnosis. I hope you are getting it. So whenever any patient coming to your clinic and complaining that the patient is having a genital ulcer, maybe a male patient, the ulcer can be on the penis, maybe a female patient, maybe the ulcer is on labia majora or labia minora. The first thing you have to examine whether the ulcer is painless or painful. Whatever it is, then the next thing you have to see inguinal lymphadenopathy, that is buboes. Okay, inguinal lymphadenopathy. Now see the first scenario. If the ulcer is painless, we are having 3 differential diagnoses. Now look the inguinal lymphadenopathy. If the inguinal lymphadenopathy is also painless, like the ulcer, it's syphilis. In syphilis, both are painless. No pain in the ulcer, no pain in the inguinal lymphadenopathy. Okay. If the ulcer is painless, but the inguinal lymphadenopathy is painful, it's LGV. In LGV, ulcer is painless. There is no pain in ulcer, but inguinal lymphadenopathy is painful. Okay, and if the ulcer is painless, okay, but inguinal lymphadenopathy is a pseudo-inguinal lymphadenopathy. Actually, it's not inguinal. It's a swelling in the inguinal region. It's not lymph node. It is Donovanosis. This is how you do the approach. I hope you are getting it. This is how you do the approach. Okay, now if the ulcer is painful, okay, now you have to see, is it an ulcer or is it multiple small blister? Is it an ulcer or multiple small blister? Okay, if it is an ulcer, so it's chancroid. Okay, and if it is multiple small blister, it's herpes. Then you see inguinal lymphadenopathy also. Here inguinal lymphadenopathy is painful. Both are painful. Ulcer is painful, inguinal lymphadenopathy is painful, that is chancroid. Here ulcer is painful, but inguinal lymphadenopathy is painless, it's herpes. So this is how you have to do the approach. Give me a minute, I will share my screen. Give me 1 minute. So here we will draw. I guess you can see my screen here. Here we will draw it. Okay. So suppose there is a male patient. Let me draw the male genitalia over here. Suppose there is a male patient having a genital ulcer. And suppose there is a female patient. Okay. Having a genital ulcer on the labia majora or minora. So this is the genital ulcer. This is the genital ulcer. Okay. Here we are drawing in a male patient. Here we are drawing in a female patient. So first we have to see this ulcer is painful or painless. Painless, painful. Okay. Is it painless or is it painful? The first thing we have to see that. You can see it's painless, painful, painless or painful. Okay. The genital ulcer in male or female both. So we are taking the approach together. Don't take two different approach in male or female. Okay. In male as well as female, the approach is same. So first of all, you have to see this genital ulcer. You can learn with the help of a diagram easily. First have a look on the genital ulcer. This genital ulcer. Okay. You have to see whether here it's painless or it's painful. Okay. So you can see, is it painless or is it painful? Now, second thing here you have to see is the inguinal lymphadenopathy. Here is the inguinal lymphadenopathy. Okay, here is the inguinal lymphadenopathy. Here is the inguinal lymphadenopathy. You can see. So this inguinal lymphadenopathy, you have to see, is it painless or painful? So the second thing we are looking here is inguinal lymphadenopathy. Okay, is it painless? Is it painful or is it pseudo? Not present or pseudo. Okay, here also, is it painless? Is it painful? Okay, is it painless? Is it painful? So you see now, you see if the genital ulcer is painless and inguinal lymphadenopathy is also painless. There is no pain in the ulcer. There is no pain in the inguinal lymphadenopathy. The answer is syphilis. The answer is syphilis. Okay. If there is no pain in the ulcer, ulcer is painless, but the inguinal lymphadenopathy is painful. No pain in the ulcer. Okay, but inguinal lymphadenopathy is painful. In that case, answer is LGV. In that case, the answer will become LGV. Okay, and if the ulcer is painless, of course, ulcer is still painless. In all these three scenarios, the ulcer is painless. You can see, just a second. Give me a minute. Yes. So ulcer is painless, but inguinal lymphadenopathy is a pseudo-inguinal lymphadenopathy. Ulcer is painless, but inguinal lymphadenopathy is not present. It is a pseudo-inguinal lymphadenopathy. The swelling is present. It is known as Donovanosis. Donovanosis. So appreciate the three things: syphilis, LGV, Donovanosis. In all of them, the ulcer is painless. Okay. Now it's the lymph node who is going to decide. Is the lymph node is also painless, or if it is painful, or it's pseudo. So that's going to decide, is it syphilis? Okay. Is it LGV or is it Donovanosis? In all of them, the ulcer is painless. Ulcer is painless. Now come if the ulcer is painful. What will happen if the ulcer is painful? Now you have to see if it is an ulcer. It's painful. It's painful ulcer. Only one diagnosis is there. The answer is chancroid. Chancroid is there. Okay. Chancroid caused by Haemophilus ducrei. It's painful. If it is not an ulcer, it is multiple small blister. If it is not an ulcer, but multiple small blisters are present instead of ulcer. Okay, so of course the answer is herpes. Herpes genitalis. Herpes. It's a virus. You're getting it, so answer will be herpes. I will discuss all these organisms in detail one by one, but this is the approach you should understand. In this case also, although inguinal lymphadenopathy is not required, based on the ulcer or blister only you can differentiate. But still, if you see the inguinal lymphadenopathy, in case of chancroid, the inguinal lymphadenopathy is also painful. So person have pain in the ulcer. Person have pain in the ulcer as well as inguinal lymph node. It's chancroid. Okay. And in herpes, patient have multiple blisters, not ulcers, and painless inguinal lymphadenopathy. That's herpes. I hope you got it completely. So this is the master chart. This is the approach to STD. Syndromes are done. So let's start the organisms now. In the organisms, I will be starting with bacteria. So let's start the bacterial infections of genital tract. First, we will discuss 8 bacteria. We are having 1 virus, 1 parasite, and 1 fungus. Quickly, we will do in the end. But the bacteria is a big section. So first, quickly, we will cover the bacteria. Let's come. So see the bacteria. So bacterial infections of the genital tract. Let's start the bacterial infections of genital tract. You can see the 8 bacteria in front of you. For ulcers, I already taught you the approach. Okay, you can see the 4 bacteria which cause the ulcers. It is Syphilis, Chancroid, LGV, Donovanosis. It is the name of the disease or the name of the ulcer. The name of the bacteria is Trypanosoma pallidum, Haemophilus ducreyi, okay, Chlamydia trachomatis, and Klebsiella granulomatis. Among them, this Haemophilus ducreyi is causing painful ulcer. The remaining 3 are causing painless ulcer. I already taught you here. You can see the remaining 3, Syphilis, LGV, and Donovanosis, they are causing painless ulcer. And Chancroid, that is Haemophilus ducreyi, is causing painful. So only one of them is causing Haemophilus ducreyi. Chancroid is painful. The remaining 3 are painless. And among the painless, then we will see the lymphadenopathy and how to differentiate them. We already know that. So broad approach you already got. Now we will see the detail of the organism under a fixed set of heading. Apart from that, we have to discuss 3 more bacteria which do not cause ulcer, but they cause genital tract infections. Like they cause urethritis, cervicitis, vaginitis, epididymitis, prostatitis, salpingitis in male and female. Okay. And we have to discuss Mycobacterium tuberculosis, which cause genital TB.
Hello everyone. I hope you found this concept clear and easy to understand. If you would like to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLife by Dr. Priyanka. So join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.